So it's now my pleasure to introduce Andy Patterson, CPCA's Director of Government Affairs. And Andy is going to be facilitating our panel this morning with our legislators, which we are so fortunate to have join us. Andy Patterson has been with CPCA since 2008, and this young lady has certainly advanced during her tenure at CPCA. She started out as a senior policy analyst for special populations. She then rose to the position of associate director of policy. She became the deputy director of policy, a director of policy, and more recently has ascended to the position of director of government affairs for CPCA. We're so proud of Andy. She holds her master's in public policy from the University of Minnesota, a BA in political science from the University of Illinois, has spent time in the state of Minnesota working in the community, developing a neighborhood action plan that won several awards for service and leadership. And we're proud to say that Andy is a graduate of the the Clinic Leadership Institute, sponsored by Blue Shield Foundation of California. So please join me in welcoming Andy Patterson.
I have to take this opportunity to just say how incredibly honored I have been for the last 7 years, I'm adding a year to that, 7 years to working for CPCA, the amazing staff, Carmela, the board of directors who's feisty and smart and keeps us on our toes, and the amazing, amazing, amazing membership. To be part of a movement is a dream come true to me, and just want to thank you all for being here. And I'm also privileged to get to facilitate this esteemed panel. I'm going to read pieces of their bios that are really amazing, and I'm not going to do it justice because these are really 3 tremendous leaders in the California Assembly, and the thing that runs through all of the bios is that you will hear is that they are social justice advocates. And I think it's really cool to just take a moment and think about that every single person in this room is committed to social justice, and how cool it is that we are all here contributing our skills to moving forward and making this world a better place. So thank you for being here today, and we can't wait to hear what you have to say. So I'll start with Dr. Pan, as he's right next to me. So Dr. Richard Pan is a pediatrician and former UC Davis educator, representing the people of Sacramento, San Joaquin counties, including the cities of Sacramento, Elk Grove, Galt, Lodi, in the California State Assembly, and serves as the chairman of the Assembly's Committee of Health. Dr. Pan continues to practice medicine at the Effort, now called WellSpace, and pursuing his passion for working with families to build healthier communities. So Dr. Pan has been part of this family, and we're so happy to have him. I'm going to point out little pieces too. So he was also at one point the director of the UC Davis Pediatric Residency Program, where he created communities and health professionals together to bring UC Davis physicians together with families and community associations to work on projects that improve the health in neighborhoods, a real organizer. And then next to him is Assemblymember Jimmy Gomez. I'm losing track. And Assemblymember Gomez, was elected in November of 2012 to represent California's 51st Assembly District, which includes East LA and numerous neighborhoods in LA. Some interesting pieces about Assemblymember Gomez. He was born and raised in Southern California and has 5 other brothers and sisters, and he immigrated from Mexico with his family in the early 70s. He has a master's in public policy from Harvard University's John F. Kennedy School of Government. And at one time, he served as the director for the United Nurses Associations of California, where he empowered nurses to better advocate for the patients through the legislative process and community service. And then,
thank you.
And then we have Assemblymember Shirley Nash Weber, who was elected in November of 2012 to represent California's 79th Assembly District, which includes the cities of Chula Vista, La Mesa, Lemon Grove, National City, and San Diego. Assemblymember Weber chairs the Assembly Budget Subcommittee number 1, which focuses on health and human services. She also attended UCLA, where she was busy and got her BA, MA, and PhD in what sounds like 4 years. Amazing. She's been on the boards of the NAACP, YWCA, YMCA Scholarship Committee, Battered Women's Services, United Way, and the San Diego Consortium. And she is absolutely a champion for education and children's rights. So please. So we've asked all three of them to take some time to address the audience and share with you what they foresee on the horizon for next year in the legislature, in the budget, opportunities, anything to share about Medi-Cal and just health and human services in general. And then when we have time at the end, I'll ask a few questions so that we can have a conversation. So we'll start with Dr. Pan.
Okay, well, thank you. It's great to be here with everyone, and I want to again thank CPCA for this invitation to participate in this morning's panel. And congratulations on your 20th anniversary. I think by the time you started this organization, I already had a chance to practice in 2 community health centers in my career as a student, so it's great to be here. And you know, over those 2 decades, you've certainly accomplished a lot in terms of addressing healthcare issues affecting our state's low-income, uninsured minority communities. And certainly your leadership and advocacy certainly deserves recognition. And I'm proud to see that you received that award from the national organization. You know, as a physician, I've cared for patients for more than 15 years. In addition to being a state assembly member, as I mentioned, I still continue to practice medicine, providing care to patients over at WellSpace, a federally qualified health center right here in Sacramento. And I've actually, think in my career, I've practiced in 5 different community health centers. So community health centers are certainly my home as a clinician. And thank you. So I certainly know on a firsthand basis the value that all of you bring, that community clinics and health centers bring to our patients and our communities. And I do want to thank you again for your commitment to providing care and improving the health of Californians. Now, as I think was mentioned, with the implementation of the Affordable Care Act, we have new opportunities for serving those patients. And as chair of the Health Committee, Assembly Health Committee, I've engaged in both legislation and policy that makes California a leader. In fact, the Washington Post cited that California was the state that was most successful in its implementation of the Affordable Care Act. And so we've worked, So we've worked hard to build on that foundation, because in many ways the ACA provides a foundation, but there's still a lot of things to work on and to fill in. And certainly leveraging my experience as a physician who primarily treats Medi-Cal patients, much of my work as chair of the Health Committee has been actually focused on the Medi-Cal program, even though I'm certainly very proud to have authored legislation that got covered California going as well. We think about Medi-Cal, it's a $90 billion program in the state budget for 2014-2015, and enrollment has reached almost 11 million individuals. We've added probably another almost 2 to 3 million more people on the Medi-Cal program. In fact, the Medi-Cal expansion is expected to bring in an additional $2 to $4 billion in federal funds to our state. And just to put things in perspective, Medi-Cal is covering approximately a third of the state's population. So it's not just a program on the edges. I mean, it's a program for a third of our population, including, as a pediatrician, half of our state's children. And given the fact that Medi-Cal is covering so many Californians, 1 out of every 3, oversight over this program has certainly been one of my top priorities. Since 2012, I've held a number of Medi-Cal oversight hearings on several important topics. As you know, the HCS has been engaging in a significant shift of particularly vulnerable populations into Medi-Cal managed care, the SPDs, the dual eligibles. We've moved healthy families into Medi-Cal and many other programs as well. We've also had to address the issue of fraud in the drug Medi-Cal program. Challenge was access to dental care, particularly right here in Sacramento County, but also across the state. The backlog in Medi-Cal applications that happened in the transition. Issues around Medi-Cal managed care. So those are moving patients into managed care, issues including network adequacy and accuracy in the provider directories as well. Even payment policies that impact quality of care. I ended up having a whole hearing on looking at the fact that Medi-Cal payment policies actually discouraged practice that was standard of care for people with asthma, and why that was so, and shouldn't they change those policies. These hearings shined a light into the administration of our Medi-Cal program and ensured greater accountability and a part of the agency, Department of Healthcare Services. And certainly as a legislator, I'm in a unique position to help departments like the Department of Healthcare Services achieve its mission. but it is up to the state and its department to inform the legislature of what it needs to get the job done. In fact, one of the things that we've touched on in many of these hearings is that Department of Healthcare Services has done a lot, made a lot of changes, and sometimes we hear issues around lack of bandwidth, not enough staff, but if they need more staff or resources to administer the Medi-Cal program so it works for all of you, so it works for the patients that are in the Medi-Cal system, it is incumbent on the administration and department to ask for those resources, not to go and say, well, we don't have enough people or manpower or workforce or not enough money to do this, the thing we need to do. Then they should go and ask us, the legislature, say we need more resources, and not say that there's not enough to work with. So certainly, through my work as chair of the Health Committee, we've generated a lot of momentum regarding to Medi-Cal oversight and accountability. The Medi-Cal program is going to be implementing a dashboard to look at quality and access. I think there's still more work that needs to be done. We've pushed the Medi-Cal program to improve its stakeholder process as well, to one that is more collaborative and having more of a dialogue. I know we're just chipping away at that, but we're continuing to do that. And we need to keep this momentum going as Medi-Cal continues to grow and evolve, and be sure that our Medi-Cal program truly does serve you, and more importantly, the patients that you serve. Now, as we look ahead to our Medi-Cal program, we have seen tremendous changes I mentioned before, and so I think there's still more significant changes to expect ahead. So we are back to the waiver every 5 years, right? So we have a discussion of a new Section 1115 waiver. And again, the waiver started off as a way to pay public hospitals, but now the waiver really is a means to change the entire way we deliver care and expand coverage to new populations. And certainly your leadership at CPCA in terms of looking at new payment methodologies is something we need to, there's an opportunity to look at that as we look at the waiver. And the waiver is both a challenge and a benefit to clinics as we shifted more people to managed care and we've expanded coverage. Now, the Department of Healthcare Services has released its waiver concepts. These are fairly broad statements, though, and said that they're beginning to engage with stakeholders. But to the end, we need to ensure that the department allows enough time to both have evaluation of the waiver as it moves from concepts to concrete proposals. And certainly, it is extremely important that the legislature has an opportunity to be engaged, to review, and approve the waiver. It should not be done solely by the administration. And so as we're moving toward this waiver, we need the time and transparency for the process of reviewing the waiver, and that all stakeholders need to be engaged. This should not be a plan that's kept under wraps and then revealed in a last minute and told we have a deadline in which to pass it. I think you're all familiar with that. Other areas I want to mention as well is access. We've provided coverage to additional 3 million people under the ACA, but coverage is not access. I think you know that. We need to ensure that we follow through and there's access. And I've worked hard keeping DHCS accountable for providing access to providers. And certainly you're at the front end of that. CCS, California Children's Services. If we're moving to a system that takes care of a whole child, what role do clinics who provide primary care play in that effort? So as we look at care for particularly not only children, but even adults with special needs, we need to be sure that there are comprehensive systems. Drug Medi-Cal, a very important program that provides services to people who have addictions and need treatment. But how Drug Medi-Cal changes in an organized delivery system, and how do we balance the need for provider access with accountability with fraud prevention, which unfortunately has occurred in the program. And extremely important, mental health. Mental health, as all of you have been struggling with, you see patients and they have mental health issues, and this very sort of confusing mix of realignment funds, federal block grants, state funds, and it's great that everyone tries to put a little bit of here and there for mental health, but we need to look at it as a system. And how do we take all the different resources, bring them together to create the best and streamlined services for beneficiaries? We don't need a confusing maze that basically makes it very difficult for people to access those services. So there is a lot of work to be done in implementation of the Affordable Care Act. I actually view that the last year where we were actually doing the laws to get it going, I mean, that may have been felt really busy, but that was the easy part. This is now we're actually doing the work. So all those ideas and things people were worried might happen, things people were hoping might happen, now we're in the part of actually the rubber meeting the road. And so certainly both Medi-Cal and Covered California is certainly a very active area of health policy, not only for this coming year, but for many years to come. And you're on the front lines. You're on the front lines providing care to Medi-Cal and other vulnerable populations. And it's vital that you stay engaged. And we need to hear your voices in the legislature. One of the things I always point out in the legislature, we don't have the staff to find out what's going on in the front lines. We count on people telling us. I don't have we're not operating a big agency. So we need to hear from you. We try to find out by talking to people, but we expect you, and I know you have great advocates here who tell us things that are going on, but we need to be sure that we're working together and being sure that the policies that we're making actually make sense in their implementation. It's not just about the bills we pass, it's the implementation. So that's what we need to hear from you. We might have passed the bill that's, quote, we thought solved the problem, but the implementation isn't effective. We need to know that so we can hold the agency accountable for appropriate implementation. So again, I think there's a lot of opportunities for us to be very successful. It's very exciting to hear everything CPCA is doing to help make not only you successful, but more importantly, patients successful. And again, thank you so much for having me here. Thank you.
I was just thinking we should have had you gone last, but we'll do our best. First, let me thank everyone for inviting me to be on this panel. It means a lot to me. Representing nurses as a political director for the Nurses Association, I can tell you that I'm very humbled when speaking on behalf of a profession. The reason why is that I always told these nurses, no matter how long I'm in office and no matter how long I'm working on healthcare as an issue, I will never have as much experience as they do, or all of you. And so I want to thank you. So I'm humbled to be here. And also thank you for making your voices heard in the legislative process. And that's how we make it better, is by making sure that the people who work in the profession are having their voices heard. And that leads me into my next comment is we should give Dr. Pan a round of applause for his role in implementing the Affordable Care Act, because I don't think we would have had a better person as the chair of the Health Committee. Next year, and I approach healthcare from just a very personal place. I'm a son of immigrants. I was born here, but my parents worked 4, 5, 6 jobs a week to make ends meet, and we didn't have health insurance. So most of my life, I got used to kind of waiting to see if I got better before we went to the emergency room. Oftentimes, leading to some serious consequences. You know, the first time in the summer when I was about 7 years old, ended up getting pneumonia, spending a week in the hospital, and creating these massive bills for my family and the burdens that they had to do to repay that. Another time, which was kind of a little bit more funny, it was funny when you think about it after 30 years, where I broke an ankle. And my dad said, just ice it for 3 days, and then he tried to get me to walk on it, right? So those stories are very common within the uninsured population, that you just wait to see if things heal themselves. And sometimes they do, and sometimes they don't. But that is kind of one of the main issues that I grew up with. I know what the populations that you're serving are dealing with and what it means. And what it means for them to go to the hospital, go to a clinic, take care of one of their loved ones. I know what it means because it's not easy. So the Affordable Care Act for me was a watershed moment. It's something that I was committed to helping out on some kind of healthcare reform, even if that didn't pass. It was something that I worked with the nurses and other medical professionals to make sure that we got there. But now we're here. And we still have some challenges. I like to remind people the Affordable Care Act was not a perfect document. It was not complete. It was passed, remember, it was passed in the Senate, and we couldn't pass it in the House. So what they ended up doing is just passing the one from the Senate wholesale, and that had some serious weaknesses. So I'll talk about those weaknesses, which I believe are weaknesses and which are going to create some challenges in the future. But the main thing is I like to kind of demonstrate this access to care is something that I think about. I was having dinner with some emergency physicians from LA County USC Medical Center. And I asked them, okay, so what is the population? Have we seen a dip in the number of individuals using the emergency room? I represent Northeast Los Angeles, East Los Angeles. And they said we've seen about statistically a 4 to 5% drop in the number of individuals come to the emergency room. They say that it's not really, they can't feel it, they just see it on paper, they can document it, but they say that it doesn't really feel that different. And that they've noticed that a lot of some of the folks that are still coming in are Medi-Cal patients. They're still Medi-Cal patients. And I asked them, and they made the comment that it was, they're having trouble getting access to care. So I know a lot of the Medi-Cal patients are assigned a managed care provider, but the question becomes how many have actually utilized that managed care provider? It was a question I was just asking Dr. Pan if we have even the statistics to see if they even used it, and I'm not sure if we do. He also mentioned that it could be because it's still, even if you have a managed care provider, you still don't have access to specialty care. At the same time, so it's easier just to go to the emergency room to kind of take care of that problem. Another issue is just what I kind of pointed out, what I've always realized is cultural barriers and habits. I used to refer to my doctor as my doctors, right? Because I never had one doctor growing up. I had multiple doctors, whoever I went to see in the emergency room. So the idea is that there's still some cultural barriers that people feel more comfortable going to the emergency room than going to a community clinic or going to a hospital or utilizing it. My parents didn't even understand that you should go to visit your doctor's office, even after they got Medicare, regularly to create that preventative medicine to make sure that they didn't get sick. So teaching people, especially from cultures that are not used to having health insurance, how to access care on a regular basis to prevent those individuals from going to the emergency room is going to be key. So I think that, the access is going to be a key issue, the reimbursement rates, how do people get paid. Additionally, one of the things that I kind of see as an upcoming issue is the additional individuals going on to Medi-Cal and what kind of burden that's going to place on access. In 2013, I carried a bill, AB 880. It was a well-known bill. It had a lot of opposition, and it was training by fire. But one of the things I learned, and this bill was going to do a couple of things. And this was regarding the weakness of the Affordable Care Act, which is anybody who, an employer, a large employer that has a certain amount of workers, if they can cut their workers' salaries low enough and their hours low enough that they can shift them onto Medi-Cal without any penalties, right? And avoiding those penalties are one of the main motivators for these large companies. Companies that have high wage salary workers, it's going to be hard to cut their hours enough to see that kind of shift. The employer mandate was put off for a year, but just recently, the Walmart Corporation announced how they're going to cut healthcare benefits for 30,000 part-time workers by literally cutting their hours below the threshold of 30 hours a week, thereby shifting them onto the backs of the taxpayers. We don't know how many employers are going to implement that strategy, but we have a hunch that 2 years ago we predicted it. Now we're seeing some of that come into fruition. So how many more will be shifted onto Medi-Cal, onto the backs of the taxpayers, and is the system going to be able to keep up? That is a big challenge. I passed a bill this year, AB 1792, which creates a report of the 500 largest employers in the state that have 100 or more Medi-Cal beneficiaries employed. So this is going to, but this is both private and public sector. So it's not just going to target the Walmarts and the Home Depots. It's going to target the community college districts, the school districts, the cities, the counties, and even the state. Because we have to understand, we have to see what kind of employment strategies, what kind of business strategies are these large employers implementing in order to reduce their costs, their healthcare costs, and what kind of impact they're going to have on Medi-Cal. It's going to be, I think it's going to be a big deal. And if that's the case, we have to figure out how do we get these large employers to pay their fair share into the Medi-Cal system instead of just underwriting their profits based on the backs of the taxpayers. It's not it's a difficult thing, and I think that we need more data, but I think the data is going to prove out. So I think those are kind of a couple of challenges. And another challenge is more of a political challenge. It's not a public policy challenge. I think we're seeing some people lose faith in the Affordable Care Act because everybody believed the minute it was passed and it was implemented that you're going to see just a drastic improvement in the delivery of care. And we've seen an improvement, but it's in that 4 to 5% margin. So how do we hold the line? How do we keep moving forward politically? Because public policy happens in a political environment. And unless we have the political will to continue forward, you might see some folks trying to roll it back. So how do we kind of keep moving forward in a political environment where the benefits are not obvious, but we know if we stayed the course, those benefits will come?
Good morning, and I want to thank the California Primary Care Association for inviting me to be a part of this panel. When I was telling my staff with Dr. Pan on here, the rest of us are just the doo-wops in the background, which is okay. You know, the doo-wops really make the song. We keep the beat rolling. But it's been great having him in with us on the Assembly and educating most of us about the health issues that are really critical in California. It's amazing you're celebrating 20 years of being organized, and obviously 20 years of expansion of healthcare. When you said you had 1,000 health clinics in the state, I thought, oh, you're talking about San Diego County, because it looked like every day I turned down a corner in the 79th Assembly District, there's a new health clinic being formed in San Diego, which is really wonderful and is providing tremendous care for so many in the San Diego County area. We're very fortunate in the 79th to have a number of wonderful health clinics and to have the service of so many groups and really the support. We've partnered with La Maestra, and I know Daniel's here, who works with us on a number of major projects and helps in so many ways in our community. The San Ysidro Health Clinic has opened up 2 wonderful new facilities, and I was on the planning committee for one of those a couple of years ago. So we partnered with one of the health clinics this past August in terms of our back-to-school efforts in healthcare, where we were able to not only open a new clinic, but offer a number of services. We had something like 1,300 citizens in that community to show up for the health fair that we had in the back to school, which provided an awful lot of screenings and for not a health and dental screening, as well as some HIV screening and you name it. So we had a really excellent health fair, and it's mainly because of the tremendous partnership we have formed with the various health clinics in the 79th District, and so we're very fortunate to do that. It's interesting that I serve on the Senate, not the Senate, oh my goodness, no. On the Assembly's committee, Budget Committee for Health and Human Services. It's interesting as I come to the Assembly that I never thought I would have actually been in a position to serve on, wasn't really interested in budget, but I'm there now. And Health and Human Services, no. I'm an educator, 40-some-odd year professor at San Diego State University, and a school board member in San Diego, at San Diego Unified School District. And so you know, my background clearly is education, and it's clearly identified as to what I've done for 40-something years with regards to schools and universities and those kinds of things. So it's interesting that all of a sudden I find myself being asked to serve on Health and Human Services. And I had to think about it, and you know, the speaker was like, don't say no, whatever you do, don't say no. And I thought about it because I recognized that when I was on the school board in San Diego many years ago, when I started in 88 or 89 in San Diego Unified School District, one of the critical issues we faced in our schools at the time was health care. And we had a very conservative community that didn't want to deal with issues of health care in schools. And so fortunately, I became the deciding vote when I was elected to the school board to basically open the first health clinic in our school at Hoover High School, the first high school health clinic in San Diego County. Since then, there have been others that have opened, but you know, tremendous challenge in meeting the needs of children, because recognizing that if children are going to do well in school, it's because all the other pieces are in place as well. You know, that the stability of the family, the ability of people to have a job, the ability of individuals to have access to some form of health care, and to have kids healthy. And schools become the safe place where people go to get health care. I mean, they believe in schools, so mom says, go to the nurse when you get to school, you got a cold, go see the nurse. So we had our high school seeing something like 1,000 kids a month who were coming in, who really needed to go to other places, and she could refer them out, but oftentimes they'd go to the nurse because they had a cold forever. Now they've got an ear infection and a this and a that and everything else that really just compounded the health situation of those children, but also impacted their ability to function well in school and to work hard to try to close the achievement gap. So I got very involved in the various aspects of the school district, not only on the academic side, but the issues of health, the issues of social services, you know, foster care, child protective services, all those things that impact the life of a child, as well as the employment status of families, getting involved in contracts and those things, because I began to reflect on the fact that in my own personal life, I was raised, we were sharecroppers in Hope, Arkansas, and I came to California when I was 3 from Hope, Arkansas. I always say because there was no hope and hope for black people. So we came to California. And, you know, and my father worked a very good job working in the steel mills of Los Angeles, but we lived in the projects for a while. And I also never had primary health care. We had major medical, which means you had to be really sick, half dead, and then you could go to the hospital. But just ongoing care was not there, and so we would often walk to the health clinic on Central Avenue for major things. But normally that would end up being your immunizations, the polio shots, and those kinds of things. And then I recognized that health care was brought to my school, because that's where we got all of our polio shots. All of our immunization occurred in the school. That's when people started saying, oh, we shouldn't have health care in schools. Well, heck, if we hadn't had our polio shots in school, most of us wouldn't be able to walk today. I mean, it was really the fact that people said, this is a place where people are, this is where they're going to be, let's provide what we need in our schools, and that was done. So, you know, so as I began to reflect on this, I said, okay, maybe there's some logic behind me being on the health committee. Well, when I got on it, I realized that it was one of those let Mikey do it things. Mikey doesn't know what it is. Mikey doesn't know how complicated it is, but Mikey might eat it, you know. Let's see what Mikey does. So, so I get on there and discover that it has this huge, huge portion of the budget that's discretionary. Everything in the school's already decided pretty much, except for a little bit. And it's all this, and there's all these constituents who come from Health and Human Services, who show up at meetings in great numbers. All your meetings are held in these big rooms because there are a lot of people. And you have lots of meetings, so that you have maybe 30 hearings. Everybody else has 6, 7, 8. You know, you meet 2-3 times a week in hearings, 2-3 times with staff. So it becomes a heavy lift. But in the process, you know, I discovered that, you know, that we had a tremendous opportunity because in the past we had done a number of things to cut health care. We've done a number of things to shift and to move away from Health and Human Services and all those issues due to budget crisis. And now we're at a unique opportunity in California to try to rebuild and to hopefully rebuild smarter than we did before. The ACA provides us with a tremendous challenge because it's not a perfect document. but it's the best we got. That's what I tell folks, you know. It may not be what we want, but it's the best we've got. And we've got to make it better every day as we move forward. My daughter's a physician, so I hear all the negatives about ACA every day as she tries to engage in her practice in San Diego and try to meet the needs at Rady's and at UCSD. And there's a lot of flaws in it, but my thing is that it's better than anything else we had. You know, and we've got to make it better. And I always remind people that when Social Security came out, everybody complained about that. When Medicare came out, people thought there would be deathbeds lying in hallways, and I remember all those stories. Now, if you try to take somebody's Medicare card, the old lady would beat you half to death with her cane, and so you would not be able to snatch that out of her dying hand. Okay, so it really is important that we recognize that all the things that move forward really require a tremendous amount of attention and care. And that's, I think, what people ought to be committed to doing, is moving forward and making it better, finding where the problems are, tweaking those problems, and hopefully getting to us to a place where we feel good as one of the major democratic countries in the world, that we're able to provide health care for everyone who lives here. And that's a tremendous challenge. And I can tell you we have not achieved that yet, because I know in San Diego, I'm meeting now with a special group to talk about, you know, what does San Diego do? San Diego does not have any county hospital in all of San Diego. Now, in San Diego County has no county hospital, so in the absence of a county hospital, how do you deal with indigent care? How do you deal with those folks who fall between the cracks? And I don't think we have a solution. I don't think we really have an answer to that yet in San Diego. We're working on it, and everybody's looking at it, and I keep putting it out there because San Diego, some don't want a county hospital, and that's fine. But then you've got to tell me what you got to do. You got to defend what you're doing, and you got to be able to provide care in an organized manner so that people who are in need of it don't have to have a PhD and a bunch of other degrees to figure out how to get care, that it's a simple path. And so when I ask that question, I have yet to get a simple answer that I understand that they ought to be able to tell me, and I should be able to converse with others. This past year, as I said, I had the privilege of serving on Health and Human Services with a budget. And we were able to do a number of things that I think are important, and as I look forward, things that we must continue to do or improve. Clearly, we expended additional $437 million in order to implement ACA, and that's important, that's significant, but I always remind myself that we spent half a million on prisons, additional money. So, so it's not like we just went overboard with the ACA. We increased the Medi-Cal eligibility rate and coverage for pregnant women, and I want to thank Dr. Pan for that, because he immediately brought it to my attention when I became chair of the budget, up to 138% of the poverty level. So we tried to fill that gap. There was a gap that was there, and there was an error. We put $4 million back into the Black infant health, which is critical, because that project. That budget was devastated, and someone said, well, why just Black infant health? And I mean, look at the statistics. It's clear that, Black infant health mortality rate is that of a third world country. And even in every aspect of the state. And so we have to look at what we're doing. We have to look at what we're doing. There may be cultural barriers or others that prevent those young mothers from getting the kind of care they need, for providing the kind of ongoing support that they need in terms of infant care and infant mortality. We hired a dental director for the state, and that was important because we have a lot of issues. And having someone at the top to administer it, I mean, an inexpensive expenditure. The budget is often, those kind of expenditures are called budget dust. The amount is so small, yet clearly it is going to be a significant piece in moving forward. And of course, we talked about access and finding folks to serve the underserved, and we spent additional $7 million on the Sloan Brown for various residency improvement programs to get more physicians into this state and to keep them here in the state when they're here. We were unfortunately unsuccessful in increasing and restoring the 10% cut to Medi-Cal. That was probably the biggest disappointment in the budget for not only me, but disappointment for every member of the Assembly, that we were not able to do that, with Democrat and Republican across the board. That is something we believed in very strongly, because it's one thing to have a program, it's another thing basically to have people who are willing to serve the population. And I often hear physicians who say, you know what, it's cheaper for me to give this person free care than to basically try to fill out all the forms and do the things that's necessary in terms of get the Medi-Cal reimbursement. We have got to basically do better, and we have to treat the professionals in the field better and make sure that when we give a person a Medi-Cal card, that there's a physician who's willing to serve them. Otherwise, it's an empty blank check. I don't need to tell you all the importance of care and accessibility. All of that's very important. I mean, we're aware of that in the Assembly. I look to the fact that if I'm involved with the budget the next year, that we will continue to basically push that issue. We tried to push it after the budget was passed. We will continue to try to bring that up. It's going to become a major issue, I think, across the board. What can you do? Clearly, your advocacy is going to be important. The fact that you're here, that you raise this issue, but also the fact that you're going to, I hope, continue to raise it with the governor. I think you reckon, and with the people, as you point out, the administrators in the administration. Many of them, I think, are just, they do what they have to do. I don't really rely a whole lot on administrators, because they can give us a lot of good information, but their jobs are on the line and they're employees of the state, blah blah blah. So I understand that, and so I don't really count on them to tell me or really take stands that's going to be outside the box. I mean, we saw that with our PACE program and providing care for the elderly, that administrators gave us the party line about that program, and yet they acknowledge it was cheaper, it was more effective, whatever. So I recognize that the limitations of what you have to do or what you do in order to keep a job. I understand that. So I don't really rely on a whole lot of that, but I do believe that we have to educate the legislators, but most of them know that. I mean, the bottom line is we didn't get pushback on 10%. In fact, many of our Republican colleagues were supportive of that. We really have to move the governor. It was in the budget, you have to move the governor. And that's something that the public has to help us do, because we can put it in and he can line it out. And that becomes a critical issue for you as to whether or not folks feel it's strongly enough about Medi-Cal and making sure that healthcare is accessible to everyone, that we fight for it, that we keep it there, and we put it in the budget. And at some point, we might get so angry to override the veto. But I think it is very, very important that our governor understands that this is an issue that will not go away, that it is critical, that it's an important issue in California, that we have to do better in terms of making sure that our Medi-Cal providers are given what they need so that people who are poor can get the care they need. And that's important. And so I just simply want to say that it's been an exciting experience this year, serving on Health and Human Services. I think we did a lot of good things in terms of healthcare, and a lot of things in moving us forward to becoming the kind of state and health provider that we'd like to be. We still have a ways to go. And I think most of us are working hard to try to put together the pieces, and hopefully you will, as things kind of fall apart and get loose in certain areas. And as you're implementing, you will see where the problems are, and that you will bring those to us so that we can continue to tweak this program so that we make it the kind of program that we're proud of. That as a nation, we're proud to be in California, we're proud to be in the United States. That's a country that really provides quality health care, that we're not just on the cutting edge of research and the cutting edge of pharmaceutical research and the cutting edge of all these things, and all those cutting edges keep cutting our heads off. That we really are taking this and implementing it in a way that's going to be beneficial for every Californian, regardless of their economic and social status. Thank you so much.
Ooh, thank you for that. I feel inspired. I don't know about you guys. So we have about 10 minutes, and I think one thing I heard everybody talk about was we all love the ACA, but we know that there's some problems with it. We also talked about some culture issues and about coverage. And one opportunity we had this year, and it didn't make it through, was Senator Lara's bill for the remaining uninsured. And it has a big budget implication, and we know how the governor feels about big budget implications in health. So I'm just curious what everyone here would react to on what do you see as the prospects for next year, strategies to make that happen. We are huge proponents of being another state to cover everybody. Everybody are critical. We have a huge uninsured population, and what can we do about that?
Well,
First,
no. Well, first of all, I want to thank both Assembly Members Gomez and Weber for their leadership in the Assembly. I mean, you've heard from them. I mean, they're really your true champions, and they've been fighting very hard, and they will continue to be in the Assembly fighting for you and, more importantly, for your patients. And so I think that we need to recognize both the work they've already done and the work that I know that they will continue to do. So hope we can give them all another round of applause here. You know, I'm proud to have been a co-sponsor of Senator Lara's bill. And I've worked throughout my life, both before I ever got to the legislature and getting children's health care coverage, 65,000 children health care coverage, and since being in the Assembly, and really saying that what we need to try to do, and you've heard this from both Assembly Gomez and Weber, we need to have a seamless system, right? We don't want people to have a PhD or an MPH to figure out how to navigate the system. And while certainly I think as advocates, sometimes when there aren't, sometimes the best opportunities like to tweak something or bend something to make something fit there, we do end up creating a bit of a complicated situation. And so certainly Senator Lara's bill takes us a very important step forward in covering a major hole in the Affordable Care Act. And that's what we've done here in California. We have covered holes that have come down from the federal government because we recognize that providing universal coverage actually in the long run will be less expensive, more efficient, and make things easier. Clearly the challenges are fiscal. I think that while there may be people who disagree with the policy of providing coverage for undocumented individuals, that I think the sentiment in general, I believe in both the state, there was a recent poll the California Endowment did, but also and for most of us in the legislature would be to let's make this happen. The issue is the fiscal part and getting the administration to understand how important this is. So that is going to be part of the strategy. I mean, it's sort of in line with what Senator Weber said as well about rolling back the Medi-Cal cuts. And frankly, one of the things that I hope the administration will be more aggressive in, especially since we're having the waiver come up, is actually getting more federal money, matching money into the state. And so I just want to put this in context because I appreciate what Senator Weber said about her experience as a school board member trying to get money for school health programs. And certainly I actually was a medical consultant for our school district here in Sacramento. And I don't know if all of you know this, but because of a dispute between the state and the federal government and lack of aggressive activity by our state, we have been leaving on the table about $100 to $150 million per year of Medi-Cal MA money for schools that has resulted, at least here in Sacramento, to 9 school nurses being laid off because they stopped getting that money. That dispute happened in 2012. They actually stopped money coming. They went back in time, 2010. Cumulatively, I think that money probably is actually larger than the amount of money that would have cost for us to roll back the Medi-Cal cut. But we're not aggressively chasing that down and getting that money into the state. And why isn't that? I mean, when we talk about budget dust, they said, well, rolling back the Medi-Cal reimbursement rate was certainly not budget dust. It was too expensive. Yet we left that much money. We're leaving that much money on the table that we're not going after. That actually should be owed to us, the state of California, through the Medi-Cal program for our schools. Certainly, if rolling back the 10% cut was such a big deal fiscally, then why didn't we fiscally be as aggressive about getting that money back to our state, money that our state deserves? And I think that's why that oversight over the department and the governor's office is so important, because there are opportunities for us to try down. Now, that's not going to be the entire answer, all right? I mean, I think we do need to step up and think about our state and our priorities and how we're going to spend our general fund and other revenues and so forth, and look at our revenue streams in the state. But we also need to look more aggressively at also where are opportunities for us to get money that we're a donor state in the state of California. We pay more in federal taxes we get back, and yet why aren't we aggressively chasing that down? We can also talk about food stamps and other types of CalFresh, actually, and other types of places where also we've missed opportunities to draw down more federal resources to help people in need here in the state of California. But I think that's part of what we need to do also, is more oversight and putting more pressure, and we need your help in trying to identify those opportunities so that we can try to create the political will and the public awareness that we could do more to get more resources. Including for the undocumented as well.
So I think the goal of Senator Lara's bill is commendable. It's something that we all want. But we still have the challenge of funding any kind of Medi-Cal expansion. Anytime we deal with the governor, that's the first thing he's got to try to chop. You know, I like that Dr. Weber mentioned that even Republicans voted to increase reimbursement rates to restore the cut. But that's the easy part. Voting for that is the easy part. I love, the reason why I always cringe when people say that is that I'm the majority whip for the Democrats. My job is to get the votes and pass the bills, right? I can tell you for a fact when it comes to getting the revenue to make sure that we have it to restore the cuts or expand Medi-Cal, the Republicans are not there ever. They're never there. And I can never get them on a vote. AB 880 that I had wasn't the panacea, but it would have brought in $1.5 billion directly to Medi-Cal per year. I had 46 votes. I was short 8 votes from the Democrats to getting it passed from the Assembly. So it's easy to vote to restore the cuts if you don't have to take a tough vote on raising the revenue to provide those, restore those cuts. So I like Senator Lara's bill is something that we all fully support. But eventually, if people really want to walk the walk, they have to vote for a legislation that brings in additional revenue, right? So that is my challenge to anybody that comes in here and tells you, you know what, I'm for restoring the Medi-Cal cuts. I'm for expanding Medi-Cal. I want you to ask them, are you willing to vote for legislation to bring in new revenue to help fund those programs? And if they're not, they're just giving you lip service.
Well, obviously, my colleagues have hit on most of the issues that are related to it. At some point, and because we do have to have the revenue and we have to have the will to implement it. I think at some point there has to be a recognition of the value of, and you pointed that out, the value of coverage of everyone, and changing the face of what that coverage looks like as well. Too often the perception is that the only folks who are uninsured are the undocumented coming from Mexico. It is more than that, and it's a much broader picture. And too often we paint that as the only brush, and so that it's easy to dismiss. And yet we have to recognize that it's a bigger picture with a lot of other faces on it as well. That becomes what we're doing in terms of that. We also have to recognize the value that it is to the average citizen. That if everyone's covered and if everyone's getting preventive care, that is more than likely you're going to have a healthier environment in which you exist. That the people who are not well are still serving your food, working in your environment, and may infect you in some way. I think we recognize, and I was talking about, because I travel to the continent of Africa often, that we recognize that health is a major issue in the world. And we cannot just put a plastic bag over Liberia and Sierra Leone and assume that that covers all of us. It does not. This is a small village now that's called the world, and all of us are affected by everyone else. And while we've allowed people to go into those countries and to take resources out, never developing infrastructure, never putting in running water, we still think of doing running water as us raising money and putting in a well in a little village somewhere, rather than looking at the larger picture of health and sanitation and those kinds of things as an issue for us, because we travel there and they travel here, and it's a health is a world issue. So we have to understand that health in California is a California issue. It's a U.S. issue. It affects everyone in the community that's there when folks do not get health care. I think when we recognize that, then we're much more willing to see this as a fundamental issue that really talks about the health of California and not just the health of the few and not of everyone that's here. And that your health, you being healthy, is actually me being healthy. And that's what's important.
So we are at time, but I just want to say, as a citizen of California, thank you so much for everything you do, for being the fighters. The clinics are here to support you, and thank you. And let's give our audience, or our panelists, a round of applause.